I think that today we have a lot of imaging modalities, and actually all of them are relevant in some insights into the disease of neovascular AMD. But on top of all of them, structural OCT is the star of all this game. And I think for all retinal physicians, the structural OCT analysis is mandatory in every single visit of patients with neovascular AMD. The progress that we have made in the understanding of neovascular AMD has mainly been based on the advent of new imaging modalities. Long ago, when we could only look at the fundus of the patients with conventional retinal photographs, it was not easy to really understand the disease. However, with the advent of dye-based angiographies, we learned to differentiate different subtypes. And later, obviously with the arrival of structural OCT, we have really been able to analyze much deeper in detail all what's going on in the macular region of patients with neovascular AMD. Much later with OCT angiography, that kind of angiography that doesn't need any dye injected intravenously in patients. We have also learned a lot about the behavior of neovascular complex. The clinical classification of neovascular AMD was primarily based on the findings of fluorescein angiography, dividing this disease into basically classic and occult neovascularisations. However, later with the advent of structural OCT, and thanks to the work published by Bailey Freund from New York, we have all learned that the different classification of the neovascularisations can be is very feasible based on structural OCT, and we have learned to differentiate type 1, type 2, and type 3 lesions based basically on our structural OCT findings, and these have huge clinical implications in terms of prognosis, response to treatment, and even the number of injections required for our patients, depending on which one of the neovascular subtype we can analyze in the structural OCT image. Basically, again, structural OCT is the key imaging modality with this. All the clinical trials are based on the structural information that we can achieve with optical coherence tomography in order to know if we need or not to treat patients with neovascular AMD. So the presence of fluid, subretinal, intraretinal fluid, sub-RPE fluid, the presence of many other features can be easily recognized with correct and accurate training with a structural OCT. I think that the rest of modalities today are still far away from being able to provide us significant information for this. However, the more imaging modalities that we can get in a certain patient, the more information that we will get for that particular case. I think there are three main unmet needs in the management and the imaging diagnosis of neovascular AMD. First of all, I think that we really need better education in terms of analyzing the structural OCT information that we achieve. Second, for patients with macular atrophy, we need some kind of new imaging modality or a better understanding of the imaging modalities that we have today in order to determine accurate endpoints so that the new treatments can be evaluated for these patients with macular atrophy. And of course, it will be extremely useful for us as retinal physicians and for our patients to have some self-monitoring device that they can use at home by using telemedicine, for example, and letting us know how are they doing in terms of structure and function with the neovascular AMD, and this will for sure decrease the burden of many visits and treatments in our daily practice.